Gravi Health, the pregnancy support.
Hello there. Today we will discuss an interesting topic, morning sickness. We will explain what the common causes are, the dangers of excessive vomiting, and how you may manage and prevent it. But first, we will start with a scenario for you to have a better understanding. Amaka is a 32-year-old pregnant woman who works at the bank. Since becoming pregnant, Amaka has experienced frequent vomiting and feeling of vomiting called nausea, especially in the morning, and feels like throwing up almost all the time. Last week, Amaka vomited over 3 times but still managed to force herself to work. While she was at work, Amaka felt as she was dizzy and was then taken to the hospital where she was treated for severe vomiting in pregnancy. Thankfully, both baby and mother were fine. The doctor went further to counsel Amaka on how to prevent and cope with it. Nausea, known as a feeling of vomiting, and vomiting in pregnancy, popularly known as morning sickness, is the most common medical condition in pregnancy, affecting up to 4 out of every 5 pregnant women to a varying degree. In some women, it can be so severe to require hospital admission or even termination of pregnancy to save the mother's life. In others, it is mild or even absent. It usually subsides just after the first trimester, around the 12th to 16th week. A very severe form of nausea and vomiting, known as hyperemesis gravidarum, usually requires hospitalization and rehydration. Although many women recover from this, some pregnancies have been lost as a result of this condition. Pregnant women must know that vomiting reduces the water and minerals in your body. It is the loss of the water and minerals that makes you feel weak after vomiting. So, it is very important that the water and minerals are replaced as soon as possible by taking fluids such as clean water, ORT, which is oral rehydration therapy, and natural fruit juices. Avoid carbonated soft drinks. Nausea and vomiting is a common condition caused by a lot of variable factors. The pregnancy hormone, progesterone, is usually implicated. This hormone reduces movement of your stomach and intestines, thus allowing food to remain in your stomach. The presence of the food there can lead to vomiting or the feeling of vomiting, called nausea, since there is no digestion. Other less common causes that have been identified include oily food. Any factor that delays digestion can cause nausea and vomiting. You may reduce the quantity of oil consumed. Drugs. Some drugs, such as iron, have been known to cause vomiting. However, before stopping or starting any medication, please consult your doctor. Excessive swallowing of saliva. Swallowing of saliva can worsen nausea or vomiting. Thus, pregnant women are advised to spit in a covered container and rinse or wash their mouth frequently. It helps reduce the frequency of vomiting and/or nausea. How to know if your condition is serious? Vomiting more than 3 times in less than a day, if you feel dizzy, if you feel weak, if you are breathing fast, or if you feel your heart beating fast, if you are producing little amount of urine, if you have sunken eyes, dry skin, or sudden weight loss. So what must you do if you are having morning sickness? You must first reach out to your care provider for care or advice. Take ORS or plenty of fluids if you can tolerate it, but if you can't, visit your provider. Take the fluids in small quantities. Don't rush it as it may make you vomit. Eat small portions of food every 1 to 2 hours. You are encouraged to eat a small portion of food, wait 20 to 30 minutes before taking some liquid. A very full stomach can lead to vomiting. Use of ginger powder has been shown to reduce nausea and vomiting. Partners must provide emotional support to pregnant women, as lack of emotional support can trigger or worsen the condition. Temporarily avoid oily or spicy foods. Take fiber-rich foods and/or fruits, such as oranges, which will help move the digestive system. Don't forget to wash any fruits and vegetables in clean water and salt to remove any microorganisms. In conclusion, we have discussed that morning sickness is a very common condition that can affect about 4 out of every 5 pregnant women. We also told you that it is important you reach out to your provider if you experience it. We would also like to emphasize the importance of rehydration by taking frequent amounts of fluids including ORS. Are you vomiting? Make sure you take enough fluids and speak with your care provider.
For more antenatal videos, tips, tools, and professional help, kindly visit our website at www.gravihealth.com or visit our social media handles on Instagram, Facebook, Twitter, and YouTube at GraviHealth. GraviHealth, your pregnancy support.